And when we were arranging this over the weekend, we weren't aware that a story would actually be on one of the front pages of the newspapers today, some of the misinformation or fake news, the stories that get out there. The idea that coronavirus has been spread by the rollout of 5G masts, and therefore some masts have been torched in Birmingham, Liverpool and on Merseyside. And FullFact, a UK independent fact checker, has actually been quoted as debunking some of those. Well, we've got someone from FullFact on as part of our experts. Tom Phillips is editor of FullFact. He's taking your calls, and he's joined by Dr. Chris Smith, who's a consultant virologist at the University of Cambridge. So I'm actually going to come to Tom Phillips first, if I may. This is a ridiculous and actually quite dangerous story. Does it show the irresponsibility sometimes, Tom, of fake news? Good morning to you.
Good morning. And yes, I think it's really important with this 5G thing. It's really important to say for a start that this didn't just start with the coronavirus outbreak. Conspiracy theories about the rollout of 5G have been building up online for over a year, several years now. They're completely baseless. There is no scientific evidence whatsoever that 5G can negatively impact human health. There's no reason why you would think it would. It's just radio waves.
Interestingly enough, sorry to talk over you, Tom, but yeah. I note that one of my early callers, and the team were just putting them through, Grinnis is in Croydon. Grinnis, you've heard about these rumours and you're concerned, I understand. Is that correct?
Hello, yes. Yes, I am very concerned. Well, because...
Tell me why, because do you not think it's a little far-fetched anyway, Grinnis?
Well, I thought Brexit was far-fetched. It's left us with an attitude. You don't know what to trust.
I see.
And now we've got this virus.
Right.
It's impacted on our attitude, right, and what we are.
And do you mind my asking, how did you pick up on this idea that 5G was in part responsible? Did someone tell?
Well, the fact that it's come from China as well, and the viruses come from China. The way that it affects the immune system is what's a concern.
Right.
It has health risk. I know technology has hit up.
So you're worried about 5G anyway, and now you're even more worried because there's a Chinese impact, and supposedly it came from Wuhan. Is that roughly what you're saying?
I'm sorry, it's connecting up. I mean, we just don't know how to trust. I mean, like I've just said, right. Brexit exhausted our attitude. Now we just don't know what to trust. Now,
all right. Well, I think you can trust FullFact. And Tom Phillips, back to you, Tom. That's the. And I understand this poor woman. She's obviously a little bit disconcerted. And these sort of fears grip hold, don't they, Tom?
Well, exactly. And I want to be very clear that it's perfectly understandable to be scared, to be frightened. This is a frightening and scary time. And so this is why trust is really important now more than ever. And that's on everybody. It's on governments and companies to act in a trustworthy manner, but it's also on people to build trust amongst ourselves. The specific connections there between 5G and coronavirus, there is no connection. For example, it's really worth noting that coronavirus has spread and had major outbreaks in countries that don't have 5G, like right. Iran, for example.
Right.
And this was based on conspiracy theories around 5G that go back before the coronavirus, that it was harmful to human health, which goes back to the same sort of theories about previous generations of mobile technology and Wi-Fi. And there simply isn't the scientific evidence there to show any of that.
Tom, let's bring Dr. Smith in, Chris Smith. Doctor, why is it that these viruses just sort of naturally appear?
They all have their origins almost exclusively in the animal world. These viruses already exist, but they've become evolved and highly optimized to live in one tiny corner of nature. And it's not until we meddle with that and give those viruses the opportunity to jump out of their corner of nature into our world that then they transmit. And we've seen this happen many, many times. We in fact can put a number on how often this happens. About 75 to 80% of what we call emerging infections, which are either new infections we'd never seen before that are beginning to circulate, or infections that did exist but were really constrained geographically and have suddenly begun to increase their range. About 75 to 80% of those infections have their direct roots in nature. They're so-called zoonoses. They're diseases of animals that jump the species barrier and get into us, thanks to us removing the barrier that would normally stop that happening.
So that speaks to, lastly, before we go back to the calls, Doctor, that speaks to the idea of the wet markets in Wuhan in China, does it?
Yep, it's the fact that you've got very large human population which are encroaching increasingly into various bits of the natural world, building new cities, urbanisation, bringing components of the natural world into those cities, the wet markets, as you say, and then we've got a very connected population. People are very mobile around the world. Before all this happened, if you'd paused time and totted up all the people on aeroplanes and said, how many people are airborne all around the earth right now, you'd have arrived at a number somewhere well north of 1 million.
Yeah.
And those people are travelling from one side of the earth to the other, and the journeys they'll be making, unless they're on some airlines like the ones I've used in the past, unfortunately, will have been well inside the envelope of the incubation period of those diseases. So in other words, you can take something horrible from one part of the world to the other part of the world, and you won't even know you've got it.
Let's go to another call. Doctor, thank you. Sam in Aberdeen, you're through to the expert. Sam, go ahead. Good morning.
Hi, morning. Thanks for taking
Not at all, sir.
my call.
Yeah.
I was just wondering if you're sort of debunkers I'm a dog owner.
Yep.
And I was wondering if they could reassure listeners that there's nothing really to worry about as a pet owner.
Okay, so this comes down to what, whether dogs or cats, I suppose, whether they could spread it on, Sam. Is that what? Let's pass the ball straight. Don't go, Sam. Let's pass the ball straight down the line to Dr. Smith. Chris.
Hello, Sam. Well, the answer is that we have now got cases of animals that have become susceptible to and infected by this new virus. It started off with a case of a Pomeranian from Hong Kong whose owner had this virus. The dog was then tested over a number of days and viral samples were recovered from the dog, but the dog didn't appear to be ill. Then there was the case of the Belgian cat, again an owner with this new SARS coronavirus. Their pet cat then began to test positive for it, but again, it wasn't clear that the cat was unwell. Now we've got Nadia, the tiger in the Bronx Zoo, who is unwell, does have a cat cough and a runny nose, and is testing positive. And now 6 other cats are also being tested because they're showing signs, and it's suggested there is a link to a keeper. So it does appear that although this is very good at spreading in humans, it may be that when we shed the virus, we may, because of our close contact with our pets, put it into the pet. What we don't know yet is if this is a one-way street or a two-way street.
So I couldn't catch. I don't have one, but I couldn't catch it. We don't know if I can catch it from my cat.
And this is the point, because at the moment we're socially distancing ourselves, but we take our dogs out for a walk, and of course they go and sniff everything and sniff everybody else, and we don't know if they're being a vector or if they're going to be infected at such a low level that they're not going to be a threat. And also, it may be it's more severe in one species, like a cat, than it is in a dog. At the moment, we just don't know, and that's an active area of research.
Let's get Tom Phillips, editor of FullFact. What else is online about animals? Is there anywhere else you can take us on this, Tom?
So I mean, there's obviously a lot of concern going around about this, and there are concern on both sides. There's also concern that people are dumping their pets because they're worried that the pets might infect them. Now, how widespread that is, I can't possibly say. That could also be a false rumour. I think it's really important to highlight, as Dr. Smith was saying, that this is a very, part of the problem here is that this is a new virus. We don't know exactly how it will behave. There is very limited evidence of human to animal transmission, and as Dr. Smith says, there's not yet any evidence that can go both ways, that an animal can be a vector, but it is an area where there just isn't enough evidence right now to say for sure.
Sam, thank you for that. That would be a game changer. My God, if it could suddenly come out of the animal into the human, that just doesn't I'm thinking about. Sam, thank you. Paul in Pontefract, you're through to the experts. Paul.
Hi, Nick, how are you?
I'm grand, sir. Thank you, sir. What's your question?
I'd just like to ask, I wonder why people are not being encouraged to make their own sanitizer.
Their own hand sanitizer?
Yeah.
Okay. Is it that easy in your view, Paul, then?
Very, very simple, Nick. Really simple.
Okay, tell me how you do it, and then we'll put possibly a health warning here. Go on.
Right. I would encourage not to tell you.
Oh, right. Okay, probably right then. Yeah. I have my concerns, Paul. Don't go. I'm sure you're doing it for all the right reasons, but surely there's a danger here, Dr. Smith, that if you make it and it's not right, you're giving yourself false sense of protection. Chris?
Well, I think you're also spending a lot of money you don't need to. Soap is really cheap, and that is the gold standard way to clean your hands. In fact, when we actually have done tests in hospitals, and I'm using that as the royal we because lots of scientists and doctors have done this, because infection control is such a big issue in hospital, costs are also a huge issue in hospital. So obviously you're looking for the most effective at the lowest cost way of cleansing hands. Actually, soap and water can't be beaten.
But let's go back to our friend Sam the dog walker. He's out with his dog, and perhaps the dog decides to relieve itself, and you do what you should do, and of course tidy up. It is helpful then to have a hand sanitizer, isn't it, Chris?
Well, hopefully he's not using his bare hands to
No,
clear
indeed.
up what
You
the
put a
dog
plastic
leaves
glove,
behind.
but you still want to. Well, I personally, when I do walk dogs, I always like to. People do sometimes need hand gel, no, hand sanitizer, no.
Yeah, but to be honest, I don't take hand sanitizer out with me. I do pick up after my dog. I put a bag inside a bag, turn the bag inside out like a glove over my hand, pick up what I need to. I'm pretty comfortable that I don't get anything on my hands. I put it in the bin and then I wash my hands when I get home. That's the safest thing to do. I wouldn't mess around making your own hand sanitizer because, and I'll tell you why, not least because you might get the recipe wrong and do yourself harm, but it might not work. And then you might have a false sense of security and you'll be in a worse position than if you just use soap and water.
You could actually burn
You cannot beat soap and water.
You could burn your skin, couldn't you, Chris, if you got it wrong, presumably?
It's not too difficult to make soap. It's called saponification, and you take fat. Actually, in the old days, you used to make soap by taking animal fat, and then you mix it with sodium hydroxide, which is caustic soda. Now, that's nasty, and that will make your skin very, very sore if you get that on it. But then you mix the whole lot up, and it reacts with the fatty acids and produces soap. Right. And that's why many, many cheaper soaps are quite alkaline and will make your skin sore if you keep washing them because of the origins of making soap that way. But if you just buy some decent soap and you're not going to use it all the time, it's an excellent way of detaching any microorganisms, viruses and bacteria from your skin.
Let's get Tom in. What do you want to say on hand sanitizer, Tom Phillips?
Yeah, I mean, I don't really have a huge amount to add there. I think one of the key things that we've seen around a misconception going around is that hand sanitizer doesn't work, which is taking a bit of knowledge, which is that antibacterial sanitizers don't work against viruses necessarily. But of course, that's been misinterpreted because if the hand sanitizer has a high enough alcohol content, it will work for these viruses because they're encased in this fatty layer. And so it does work in the same way that soap works. But yeah, soap and water is still, as Dr. Smith says, the gold standard. A
couple that have come in on text, tweets and emails. These are concerning very dietary products. Can lemon juice beat it? Is it right if you eat a lot of garlic? I've got another one. If you eat a lot of chili, I don't think chili con carne, just chili. Is there anything? I can't believe there would be, but Dr. Chris, over to you.
No, probably not. I suspect that the business with garlic might be because of the connection with bats and vampires and that kind of thing, so that's a bit of fake news. Right. Chili, no. I mean, chili, very, very tasty. I thoroughly enjoy eating it, and certainly if it's part of a balanced diet. Chili, very rich in vitamin C. There are people who believe that lots of doses of vitamin C will boost your immune system. Unfortunately, they're probably misguided. There's not very much evidence for that at all. Some, but not a huge amount. It's just part of a healthy diet, really. So not much to be gained by eating any of mega amounts of any of these things. So no, what you eat, as long as you eat a healthy diet and you provide all the micronutrients you need, that's what your body needs to be a fit fighting machine to fight this thing off. Mega doses of anything are probably never good.
Right, let's go to another caller. Evelyn in Barking, you're through to the experts. Your question. Sorry, Evelyn, is it Evelyn? Good morning.
Good morning.
Yes.
My question is, could you catch the coronavirus twice?
Can you catch it twice?
Yeah.
Okay, I'm going to stay with the doctor on this one, Tom. Don't be offended. Dr. Chris?
Hello, Evelyn. The answer is that it's almost certain that you can't. There are lots of other coronaviruses, so you could catch a different kind of coronavirus, but this one, as far as we can tell at the moment, and there's been some dodgy news going around about people testing positive and then testing negative and then testing positive again, it's almost certainly rubbish. It's because the tests we've got for it aren't perfect and they miss cases. So when you test someone for it, the test says you've got it, then it says you didn't have it because when they tested again, they didn't swab the right bit, and then they tested again and found you did have it, and that's just because the test is rubbish. When you've had this virus, you will make a strong immune response to it. That immune response will include antibodies and white blood cells that will eliminate the virus from your body, and they've put virus into animals to test that this is the case, and the immune system clears the virus out of the body. That immune response will persist for at least an appreciable period of time afterwards, protecting you from catching it. Now, what we don't know is, will that immune response last for a year, 2 years, 5 years, the rest of your life? At the moment, we're unsure. So it's possible that a long way down the track, you could catch it again. But in the very short term, it's almost certain that you won't be catching it again.
Evelyn, thank you. Peter in Oxford Circus. Peter, your question.
I've got a question whether this virus was designed in a lab. And the reason why I'm asking that question is because I don't know any cases that animals get flu from people, HIV, Ebola, and this particular virus keeps jumping from people to animals, which is very rare.
It jumps one way. I see what you mean. Sorry. Okay, right.
Yeah,
okay.
But it's quite rare for animals to actually get virus from people. So how come this particular virus actually jumping across quite frequently?
I'm going to bring the doctor in a moment. But again, Tom Phillips, this speaks to the concerns that you and your colleagues are trying to address at FullFact.
Exactly, and this is another conspiracy theory that we've seen going around a lot, is that this virus was genetically engineered. We've even seen at least one national newspaper floating this theory based on absolutely no evidence at all. I think it's worth saying, and obviously the doctor is much better placed to speak to this than I am.
I'll get him in.
But there is not only no evidence that it was engineered in a lab, there's good evidence that it wasn't. There's a paper in Nature which was published that looked into this and found that there was no evidence of genetic engineering, and the things you would expect to see in it, if it had been genetically engineered, aren't present. And I think the key thing is that it is not actually unexpected. There is no unusual explanation that you need for this. This is a very natural and, as the doctor said, a very common occurrence.
Let's get Dr. Chris back in. Chris?
Well, Occam's razor says, put simply, that if there's a simple explanation, that's going to be the right one. The simple explanation is, and we have the benefit of hindsight and past experience to back this up, if you look at animals in these wet markets in China, we know that animals brought into those markets have viruses. We know if you put animals together in those markets, which they do, which are not normally encountering each other in nature, there is a chance for viruses from one group to jump into the other group. When viruses from one group of animals end up in another group of animals, then they can combine forces, as it were, and swap and trade bits of genetic information between the two viruses and produce hybrid baby viruses. And those hybrid baby viruses can mix some of the best and worst bits of both, and then they can jump the species barrier again and get into people. That's exactly what happened with SARS Mark 1 back in 2002 to 2003. We think history has repeated itself here. We can find the direct ancestors of these viruses that are now circulating, causing this pandemic, in bats and in another species called a pangolin. So we can actually find the smoking gun here, and given that we can find that in animals already and it's widespread in these animals, it's much more likely that a scientist didn't do this and then cover their tracks by making it look so convincing. It's much more likely that nature did this. We just gave it the opportunity.
How did it get into a tiger in a zoo?
Because what happened is that the keeper had it. This is a very infectious virus. The keeper, having close contact with those cats, because the keeper would have been preparing food for the cats, touching it, possibly sneezing on the food, and this virus will easily transmit via that route, and the cat probably picked it up via that route.
Thank you for that, Peter. Thank you for your call. Shiva in Ilford. Shiva, you're through. What's your question? Good morning.
Hello, good morning.
Hello.
I know there are conflicting opinions about face masks.
Face masks.
I know it can't completely stop the virus from getting through, but is wearing face masks reduce the chance of contracting the virus?
Well, I'm going to go to Dr. Smith, go to Chris first, because I've heard both sides about face masks. What do you understand to be the gold standard here, Chris?
Hi, Shiva. The answer is that face masks are very effective if used in hospital in the right way by the right people, and they're the right sort of mask. When doctors and nurses are dealing with patients who might be very infectious for any kind of respiratory infection, but especially in this case, they'll use something called an FFP3 mask. These fit-tested masks have a very high stringency. They're very good at excluding things that are smaller than this virus, which that's really saying something, because this virus particle of this new coronavirus is about 100 nanometers across. That's a 10,000th of a millimeter. Absolutely tiny.
Okay, compared to a pinhead, I mean,
if you took a pinhead, which is about 1 millimeter across, that means you could have 10,000 of these viruses lined up side by side and have room to spare. So they are tiny. Now, that means with something that tiny, the infectious dose of this virus is about 20 particles. So a person who's infected is coughing out thousands to millions with each cough into the air around them. You can see that it doesn't have to be many odds to get a successful infection or transmission event. So the thing is, if you've got a mask that fits very well and can exclude tiny particles, you're in much better shape than someone who's wearing a cheap surgical mask, where if you hold it up to the light, you can see between the paper fibres it's made of to a virus on that sort of scale, those gaps between the fibres might as well be, the Thames or something, how big that gap is. Absolutely huge. Also, they don't fit your face properly, these masks that people are either making or wearing.
Are they basically pointless?
The answer is that if you are trying to protect yourself, most of the transmissions of this virus occur in the home. 80% of transmissions occur in the home where people don't wear masks on the whole.
Right.
So if you're observing the social distancing guidance that the government have already laid down for you, then actually you're already protected when you're out and about.
Got it.
And you're not wearing the masks where most of the transmissions occur, so they're not really that beneficial. Where they may have a small benefit is that if you are, say, highly infectious and coughing and sneezing, and a doctor or a nurse puts one on you to cut down the risk of you spraying out virus quite so readily into the environment around you for a while, then that may protect other people secondarily. But you shouldn't be out and about if you've got all those symptoms anyway, so therefore there's not a lot of point in other people are wearing these masks because they're not making much of a difference to their risk.
Shiva, thank you. We've got time for at least one more, maybe two. Michael in Southampton. Michael, your question. Go ahead. Good morning.
Good morning, Nick. Hi. I've got a question regarding the clarification and hurdle jumping in respect of COVID-19 being infectious. On the government website, gov.uk, it says, status of COVID-19. As of 19th of March 2020, COVID-19 is no longer considered to be a high consequence infectious diseases, HCID, in the UK. And further down it says the Advisory Committee on Dangerous Pathogens, ACDP, is also of the opinion that COVID-19
So what is your question, Michael?
should no longer be classified as an HCID.
What is your question?
Yeah, so my question is what hurdles have the government gone through in order to classify it as an infectious disease?
All right, this is perhaps a little bit out of airspace. Both. I'm going to bring Tom Phillips.
I do know what he means, actually, if I
Come
may,
on, Tom.
Nick.
Yeah. Tom Phillips? Oh, sorry, Chris.
It was me. No, I do know what he
Chris,
means.
go ahead.
And when we first had this virus and we didn't know what we were dealing with, it was categorised as what is called a Category 3 pathogen,
right?
Which is is second down from the highest level of pathogen and therefore attracts the second highest level of control in a laboratory. Very specific way of handling it in a very specific environment, etc.
Right.
That was causing a bottleneck in laboratories because that meant very specific training for staff. It meant only a limited handling capacity, etc. When it became apparent that this is very widespread and you're basically classifying something which 3 million people in the UK have probably got and walking around with at the moment as something which is, one step down from Ebola,
right.
we declassified it a bit and it went down to, it got what's called derogated down to a Category 2 pathogen, which meant it could be handled under more normal conditions in the laboratory. So that's what they mean. And what they had to do was to have various risk assessments and things to say, well, we're comfortable for laboratories to handle this at a slightly lower biosecurity level because we appreciate it is spreading, it's very, very common, and that will ease the tension and the pressure in the lab a bit so it can be handled more easily and with a faster processing.
Tom, you've got something to add on this. Tom Phillips.
I think the doctor's actually mostly covered that, but yes, this is a misunderstanding of what that classification means. It doesn't mean that it's been downgraded from a problem to not a problem. It just means that for exactly those smaller, more detailed purposes, it is just being treated slightly differently. So yeah, it's understandable, and I think the government could maybe have clarified that webpage a little bit better, but it doesn't mean what people think it means.
Last one via email for you, Chris, I sense. This is from Daisy in East London. Can the disease be passed through mosquitoes?
No. And although mosquitoes are arguably the most dangerous creature on Earth because they account for more infectious diseases and therefore more deaths, causing by malaria up to 1 million deaths per year, 70% of them in children, this, thank goodness, does not spread via that route. This is an airborne infection on the whole, and also an infection that can spread from surfaces contaminated by droplets that have landed on it from the air.
I will end it there, gentlemen. I thank you so much to both of you. You heard from Dr. Chris Smith, who's a consultant virologist at the University of Cambridge, and you heard from Tom Phillips, who's editor of FullFact.